Well, good afternoon, Rotarians. Today I'm pleased to introduce Dr. Kristin Woods, who will be discussing the evolution and current state of Mercy Health Physician Partners, a Mercy Health physician network in West Michigan. Welcome, Kristin. Dr. Woods serves
Thank
as
you.
the president of Dr. Woods serves as the president of Mercy Health Physician Partners West Michigan, a multi-specialty medical group consisting of over 800 providers and 95 clinics. In this role, she has responsibility for strategy design, clinical and financial operations, and cultural integration. Previously, she held executive positions as vice president of Mercy Health Physician Partners Muskegon, a 250 provider medical group with 42 clinics, and medical director of National Solutions at Blue Cross Blue Shield of Michigan. In addition, Kristin has 17 years of clinical experience as a family physician here in Muskegon. She has an extensive background in practice and organizational transformation and has led the evolution to a patient-centered medical home locally and the integration of a large, complex multi-specialty medical group in the West Michigan. She's a trained executive coach with past certification as a facilitator of insights discovery. She received her Master's of Medical Management from Carnegie Mellon Heinz School of Business. Welcome, Kristin.
Thank you, Dr. Sprague. I appreciate that.
Yeah, so let's start. First, will you please just describe Mercy Health Physician Partners and your role within the organization?
Yes, as you mentioned, I'm president of Mercy Health Physician Partners, which is part of Trinity Health and part of Mercy Health, but we're the physician and provider employed arm of the organization. So as Dr. Sprague mentioned, we have about 800 physicians and advanced practice providers within the group that service just over 100 clinic or hospital locations in this health system in West Michigan. We generate about $250 million in revenue annually through our efforts. And we partner closely with the hospitals and our provider hospital or physician hospital organization to create a coordinated, high quality clinical network of providers to serve the communities.
Great. Now, how is MHPP evolving to improve the patient experience? I know that's a major measurement that's Medicare, Medicaid, and commercial insurers are using, that patient experience.
Absolutely. And it's critical because we know that engaged patients are more involved in their own health care and have better outcomes. So patient experience is really critical. And we're looking at a couple things. First of all, our practice locations and facilities, and how do we make it convenient and easy for patients to access us? So we have been evaluating our locations across the community. One of the things we always ask about is transportation. So almost every one of our practices is on a bus route so that all patients can access us. And then with our facility structure and design, we're trying to make it more convenient for patients to access all needs of care. A good example of that is our recent Norton Shores Medical Office building that just opened in January, where we had 3 primary care offices come together and co-locate in this new building. And then there are also physical therapy, pharmacy, urgent care, radiology, and lab services right on inside that same building. And the pharmacy is soon to open. It's still coming. But by co-locating those services, it makes it convenient for patients to have that one-stop shop experience. The other medical office buildings that provide that same experience are the Lakes campus out on Harvey, and then our North Side Clinic in North Muskegon. And then one of our best hidden examples of a newly opened clinic is on Quarter Line. It's right embedded into Muskegon Community College's campus, and it's a smaller family medicine clinic that during the pandemic has been used to service patients with potential COVID. But we opened that clinic because it was a medical desert up in that community. There weren't medical providers there. And this clinic is serving the college students, staff, and community members around that space. Once the pandemic is fully managed, we'll convert that back to a traditional family medicine clinic as it was intended.
Great. So, how are you employing technology to enhance the patient experience and convenience?
That's a great question. It's another piece of convenience. If you're like me, I would much prefer to do my banking from the comfort of my home and maybe at 11 p.m. And we need to think about how we can enable technology to further engage our patients and make it easy for them to get the care they need. So, um, excuse me. So, as far as access goes, we now have had over 22,000 patients schedule their appointments with our providers online through our online scheduling service. And that includes new patients to our docs as well as established patients. And then we're also using online scheduling for some of the vaccine registrations that we're participating with. The other benefit of technology is the portal through the MyChart application. We use an electronic medical record called Epic, and every patient has access to their chart through the portal. Through that access, they can do the online scheduling, or they can message their provider or care team with questions about refills or side effects of a medicine or just general medicine questions and get a response within 24 hours. Now, with the other way that we're using technology is to provide video visits for patients. And we really ramped this up during the pandemic when before we had safe procedures to bring patients into the offices for face-to-face care. We started to leverage the ability to do telemedicine. So patients can schedule visits with their providers and conduct it from the comfort of their home, right over the phone, or through their computer. And we're hoping to continue this in a big way going forward, even after the pandemic. It's been convenient for a lot of patients and a real time saver for many patients. Finally, we also recognize that a lot of patients, there are still a number of patients that aren't comfortable with all that technology, and they just want to pick up the phone and talk to a person. And so we're not abandoning that route either. And we've improved our phone systems so that we can better manage our phone volumes, phone calls, and wait times, so that if you do choose to call our office, you can talk to a real person and get answers to your questions and all your needs satisfied.
That's great. So, when I retired about a year ago, one of the things that occupied a lot of my time was helping friends and neighbors and Rotarians find a physician because it was challenging. How's that going?
I think we're getting a lot better with that. We have had a number of providers transition over the last year, just with some of the changes within our organization, but also the impact of the pandemic on some of our workers. And with those changes, people have had to find new primary care physicians. So there is a convenient way to find which of our providers are taking new patients, and you just go right onto the Mercy Health webpage and click Find a Doctor. And then it's very easy to search for providers through filters. You can pick which type of provider you're looking for, whether it's family medicine or a pulmonologist or a gynecologist. And you can also indicate your zip code and which mile radius you would want to search from. And you can select if you'd prefer to have a male or female provider as well. All of our provider pictures are up on the portal, so as the names come up for you to choose from, you can also see what that new provider looks like. And then, as I mentioned before, you can schedule that new appointment right online if you're comfortable doing that. And if you still prefer to call, you can call our offices. And then on the website, it also says which providers are taking new patients. So it's all convenient to access. One of my goals this coming year is that we'll get more of a navigator in place that will help assist patients that aren't as fluent with online resources, so we can assist patients find their next provider. And also, we found that several patients ask their specialist for a new primary care provider, so we want to equip our specialty offices with that same resource to help the patients find their way to a new primary care doctor.
Great. That sounds like people are getting access that they've wanted in a much easier way. So, despite all the services that Mercy Health offers, some folks still feel they need to go to Grand Rapids, University of Michigan, or Cleveland Clinic for specialty care or higher quality care. Can you comment on this?
Yes, I'd love that opportunity to highlight some of the very high quality specialty care that we deliver. As I mentioned to start, we offer a wide variety of primary care physicians, from family physicians to internal medicine and pediatrics. Um, What's really important about our primary care services is that we offer wraparound coordination of care. What I mean by that is we don't just address the medical needs, but we also screen for social determinants of health and those social needs that can impact a person's ability to get care. And we partner with care management and pharmacists to make sure that patients can access their medicines, and we have that whole team working. One of the high quality areas I want to brag about for a minute is that our primary care group earned a gold status with the American Medical Association for our management of hypertension. So in order to earn this award, over 80% of your patients have to have their blood pressure at goal, and we sit about 82 to 83%. So we're very proud of that in primary care. As we look at some of the specialty care that people leave the community for, I want to highlight our cardiology program. Muskegon has had a high quality open heart program and cardiology program for a number of years, and we're just continuing to expand on it. We're now offering electrophysiology care for arrhythmias and irregular heart rhythms. We're also performing TAVRs, which is a transcatheter aortic valve replacement for patients that previously couldn't have open heart surgery to have that aortic valve replaced. They can now do it with a less invasive procedure right here in Muskegon. And we're doing the Watchman procedure, which is a newer procedure for people that need blood thinners to prevent strokes if they have atrial fibrillation. But if they don't tolerate the blood thinners or they're at risk of bleeding from their blood thinner, they can have this one-time minimally invasive procedure and then not have to take anticoagulants. So we continue to expand the services offered right here in Muskegon through cardiology. The other area I want to highlight is in our neurosciences. We continue to grow the number of neurologists and the services provided through our neurology program. In addition to general neurology and neurosurgery, we have a complement of osteopathic manipulative medicine doctors that do the non-invasive management of chronic pain and back problems, as well as other pain throughout the body. and they're part of that neurology team. In addition, we've been able to bring in an epilepsy provider into the community through our connection with Hauenstein. So Mercy Health, the medical group, has the Hauenstein Neuroservice Center in the Grand Rapids area, and the medical group partners across the community to provide subspecialists in neurology like neuro-ophthalmology and neuropalliative care, and the list goes on. So again, those are just a few of our programs that we deliver high quality intensive care right here in the community, and people don't need to leave and go to Grand Rapids or across the state to Ann Arbor to get that same level of care.
Great information, and thank you for that. There's a lot of concern about inequities in healthcare and healthcare disparities. What is MHPP doing around that issue?
Well, as you well know, we were founded by the Sisters of Mercy over 150 years ago, and it was on the premise of reducing health disparities based on income or ability to pay or social status. So this work to create a diverse and inclusive environment and to eliminate racism and health disparities is really just a renewal of the mission and values that we were founded on. And this is just a fun story that I'll share that I just learned in doing some of this work. But the Catholic schools and hospitals originally were established to prevent discrimination against minorities. In the 1800s, most Catholics were immigrants and were poor. And the public schools at that time used the King James translation of the Bible, and they promoted white Protestant beliefs in their ethos and in their instruction. So the Know Nothing Society, the Ku Klux Klan, and many white Protestant temperance societies sought to purify the U.S. of those that they thought were stupid, lazy, ethnic drunk Catholics. So that's a little background in how we started forming the Catholic hospitals and schools, and why I say it's really just a renewal of that commitment to serve everyone. So to that end, we've developed a diversity and inclusion council that partners with our hospitals, which each have their own separate diversity and inclusion council, and with our system office to bring in resources and expertise in how we can better create that environment. Our council has 5 specific goals. One is to create greater diversity in governance. Second is to create diversity in talent and how we hire. The third is to create an inclusive and welcoming environment, both for the patients that we serve, but also for the colleagues that work for us. The fourth is to grow and develop diversity in our suppliers. And then the 5th goal we have is to eliminate health disparities.
Great. Is there a specific attempt to recruit minority providers?
There is. We've just been digging into the data, and right now 85% of our providers identify themselves as white or Caucasian. Only 11 providers in our medical group identify themselves as Black or African American, and about 9 as Latino or Hispanic. So that is not representative of the community that we serve, and we are looking at ways that we can create a more diverse work culture for the providers. The one area where we're excelling would be in the gender. At this point, 43% of the physicians in our medical group are female, where if we look at data across the country, it's closer to 36%. So we're doing well there. We're also not doing so well in nursing. Men are very underrepresented in the nursing population. So not just in our physicians and providers, we have work to do in the nursing area as well.
Great. Yeah, that's an aspect that a lot of people don't think about. So, Kristin, in the time we have left, any closing comments for our Rotary Club?
I just want to thank you for the time to share what we're doing at Mercy Health Physician Partners, and invite you to ask any questions that you have, or share experiences so that we can celebrate our wins and improve on opportunities that you might present.
Great. Well, thank you so much, Kristin, for joining us today and for a wonderful presentation. At this point, I will turn things back over to President Mark.